Support for the Living Wisdom podcast is provided by In Touch Pharmaceuticals, a long-term care pharmacy committed to meeting the specialized pharmaceutical needs of their clients. Visit intouchpharma.com. Welcome into our Living Wisdom podcast. I'm Karsten alongside Deb Carriveau, and we are on the topic of depression. And we really want to talk about depression when it comes to you caregivers. You have a lot on your plate. We know a lot of you are helping those family members who are walking through this journey. You know, people take that on and they want to help them before maybe they take the next steps. And so you and I were chatting that there's a large percentage of people who are doing that that will then experience depression. So let's talk a little bit about that and how if you're sitting at home and you're listening to this thinking, I am feeling depressed, you are 100% not alone, right?
Yeah,
like
absolutely.
This is something you see a lot.
That's right. And any caregiver taking care of somebody with dementia, just by the nature of the disease process, is at a much higher risk to develop depression than other types of caregivers, just because of the nature of the disease process and what the journey looks like. So why is that? So one thing is that because it's a constantly changing, progressive disease process, caregivers of loved ones with dementia oftentimes feel off balance. They feel like they are constantly trying to adjust and change, and they just feel like they get one thing resolved and handled and something else comes up. So it's just this constant changing, progressive kind of situation. The other thing that's happening is that this disease process is impacting the nature of your relationship with your loved one. And because it changes personality, it changes the perception of reality, it changes my ability to relate to you. So all of a sudden now you're changing and grieving the loss of that relationship that's very, very significant. In addition to that, this is a disease process that causes the caregiver to be constantly vigilant. So it's not like you can just say, oh, I'm going to check out for 2 hours and take a break and leave your loved one, independently on their own. It's just not possible to do that with the nature of this disease process as it continues to progress. So because of that, there's a lot of psychological, emotional impact and stress that happens for the caregiver. And on top of that, they're dealing with this long-term anticipatory grief, that grief that starts at the time we get the diagnosis. And that can last, that sense of loss and change and constantly learning a new piece of this disease process that's impacting your loved one and your situation. That could go sometimes 5 to 7 to 10 years sometimes. So it's this constant level of stress and unrelenting emotional roller coaster, if you will, that people can be on.
I can only imagine that while you're so focused on your loved one going through this, you may not be focusing on yourself and maybe how you're changing. And you were saying that those who have dementia show symptoms of depression very differently than their caregivers. So if you're a caregiver, what are some symptoms that you'd be seeing if you are going through this?
So most caregivers are going to go through some of the typical signs that we think about with depression. So you might be sad, you might be tearful at times, you're going to be frustrated about not being able to control or fix the situation. But what we're talking about is something that's way beyond just having the blues, if you will. We are talking about feelings that might cause you to feel resentful toward your loved one that you're caring for. You might find yourself becoming very irritable with them and just the symptomology that you experience as part of this disease process. You find yourself not eating or overeating, sleeping too much or not sleeping at all because you're on this constant vigilant kind of thing and you feel like you can't ever take a step away or check out at all for yourself. The other things that we oftentimes see that are common is that caregivers, when they're in this really severe depression, experience this sense of saying to themselves, I wish they would die. I wish they would just go. I wish it would just be over. And suddenly you're becoming very obsessed about time frames, and you're asking people all the time, how long is this going to last? When are they going to pass? You know, those kinds of things. Not because they don't love their loved one. It is because of the nature of the disease process and the kind of toll that it takes on the person who's really doing the primary care. The other piece of it is if you see yourself drinking more, or you see yourself taking more over-the-counter drugs to either, you know, pep yourself up or sedate yourself to calm down. You know, typically you have a couple of glasses of wine a week, but now you're drinking 2 or 3 glasses of wine a day. Yeah. So those kinds of things all need to be seen as red flags, and potentially you are cycling yourself into some very severe destructive depression symptomology, and it's time to get help.
Yeah, and by the way, no judgment, because
No,
a
not
lot
at
of
all.
people go through this, so
That's exactly
that's why
right.
we're talking about it.
Yeah.
So you're having these feelings. I'm assuming you're reaching out to your physician saying something's going on. What's the treatment process like?
So for whatever reason in our society, we have a tendency to think that things we identify as emotional or mental health issues aren't important,
Yeah.
or there's a lot of shame attached to those. So we don't want to necessarily say to somebody, hey, I'm having a hard time doing this, I can't keep it up, I need some help. First thing I want to say is, you need to give this kind of symptomology the same attention you would if you were diabetic or, you know, had high blood pressure. This is a, you know, very normal process as you're going through this day-to-day life management with somebody with dementia. So don't be afraid or ashamed to ask for help. Next thing is see a professional. And 2 categories of professionals. One is you need to see someone who, from a medical perspective, is able to assess your depression and then determine what would be the best scenario for you. It might be something as simple as just you need to talk to somebody.
Yeah.
You know, get some therapy, get some counseling. You might need to talk to a friend or a pastor. None of us who are dealing with a loved one with dementia can do this journey alone. Nope. We try, because for whatever reason we put these expectations on ourselves that we should be able to handle everything, and you know, we're going to be super daughters and super husbands and you know, super wives, and be everything this person needs. And that's just not humanly possible to do that alone. Just by nature of this beast, that's just not possible. So you have to be able to talk, process your feelings, get them out. That's the only way you're going to be able to let go of them, and then figure out how to manage things in a healthier way. The other thing is things that you can do for yourself beyond the professional help of, you know, potentially getting antidepressant to help elevate your mood and help things be easier to manage emotionally and psychologically. And sometimes that doesn't have to be a forever kind of thing. It might be you just need a little support and boost in this moment to get you over the hump until you can kind of get things to stabilize and deal with it. So there's no shame in that. There's no issue with, you know, saying you might need a little help. And then we talked about counseling or talk therapy with whoever you're comfortable with. It needs to be somebody that you know you can trust. I oftentimes suggest to family caregivers, talk to other people around you. Who have they gone to? Who do they trust? Who have they talked to and been comfortable with? Because if you can't trust and be comfortable with the person that you're going to for help, you're not going to utilize that person, and you're not going to really be able to openly process what you need to. And then the third piece of this is take care of yourself. You cannot continue to do what you're trying to do for your loved one if you don't take care of you. So making sure that, number one, you stay physical whenever you can, even if that means you take your loved one with you, you take a walk every day, you go play cornhole, whatever it is, you need physical activity to keep your mood elevated, okay? Sometimes it's just a walk outside in the sunshine. It might be 14 degrees, but bundle up and go get some vitamin D from the sun. So staying physically active, we recommend about 30 minutes, 2 to 3 times a week. And it doesn't have to be, as a caregiver, we're all going, I don't have 30 minutes to, exercise. Break it down. It doesn't have to be 30 minutes in one shot. You can do 3 10-minute, things. You can do 6 5-minute things, however it works for you. Build it into whatever you can do. The other thing is, don't neglect your rest. We feel like our loved one lays down to sleep, so then we have a to-do list of 10 things that we have to do in that couple hours they're taking a nap. Don't do that to yourself. When they rest, you rest, because when they're not resting, you can't rest. Yeah. It's very similar to being a new mom, okay? And you have a baby. You sleep when they sleep, right? And you just learn to reprioritize those things on your to-do list. Give yourself permission to say, this can wait, I cannot. My well-being is more important, because if you can't take care of you, you can't take care of your loved one, all right? And the other thing is, understand it's not an issue for you to openly say, I need help. Reach out to people. Most people who love you and your family member and care about you want to help, but most of them don't know what you need. And so there is no shame in reaching out to a neighbor, a sister, a fellow church member, and saying, I really could use a couple hours just to myself to take care of, me and whatever I need. And you're the only one that can identify what are those things that make you feel good. Okay, you need to experience those things on a routine basis, because the more joy and pleasure in those moments you can create for yourself, the more stable and elevated your mood is going to stay. But the more you sacrifice those things, thinking that you don't have time, the more risk you're putting on yourself to be in a position where you're going to really experience severe, severe depression.
Support for the Living Wisdom podcast is provided by In Touch Pharmaceuticals, a long-term care pharmacy committed to meeting the specialized pharmaceutical needs of their clients. Visit intouchpharma.com.